What happens to your body when you quit smoking? Hello and welcome, beautiful people, to a healthy dose. I am Dr. I. Let's get healthier, happier, and stronger together. Let's look at the timeline to see what happens to your body when you quit smoking. Let's start with 20 minutes. Within half an hour of your last cigarette, your heart rate and blood pressure typically drops to normal levels. High blood pressure is often called the silent killer because it can have dangerous effects without any symptoms. Now let's look at what happens after 12 hours. Smoking increases the amount of carbon monoxide in your blood by 3 to 15 times compared to non-smokers. When you quit smoking, the level of carbon monoxide in your blood returns to normal within a day. That makes room for more oxygen in your red blood cells, which is essential for the health of your heart, brain, and other organs. So what happens after 24 hours? Smoking is a major cause of heart attacks. After just one day without smoking, your risk of having a heart attack starts to decrease. The longer you go without smoking, the lower your risk of having a heart attack becomes. If you have already had a heart attack and you quit smoking, your chances of having another one are cut by half. Now let's look at what happens after 48 hours of you quitting smoking. Toxins in cigarette smoke kill the cells that help you taste and smell. Fortunately, these cells seem to grow back quickly when you stop smoking. 72 hours post-smoking. Cigarette smoke inflames your bronchial tubes, through which air moves in and out of your lungs. This can make it harder to breathe, but it starts to get much better just 72 hours after you quit as the bronchial tubes start to relax. 2 to 12 weeks post-smoking, blood circulation starts to improve almost immediately, but after a couple of weeks, you might notice even bigger improvements. You may start to feel sensations more easily, and your hands and feet will be warmer as well. Good circulation is also linked to healthier blood pressure, pulse, and blood oxygen levels. 1 to 9 months post-quitting smoking, you will start to cough less and breathe better. Tiny hairs in your lungs called cilia start to grow back. These help clean out your lungs and lessen infection. Your lung function could go up by as much as 10%. 1 year after you quit smoking, your risk of both heart disease and heart attack dropped to about half that of a smoker. 2 to 5 years post-quitting smoking, smoking raises your risk for certain cancers. You can help lower it again if you quit. After 5 years, your risk of mouth, throat, esophageal, and bladder cancers will be just half of what it was when you smoked. Your risk of cervical cancer will fall to that of a non-smoker. 5 years later, smoking speeds up the formation of blood clots that can lead to a stroke. But in as few as 5 years after you quit, your risk of stroke could fall to the same as that of someone who does not smoke. 10 years later. 10 years is how long it takes to cut your lung cancer risk to half that of a person who still smokes. At this time, your risk of cancer of the larynx and of the pancreas also goes down. 15 years later, congratulations! You have done much to reverse the damage that cigarette smoking causes. Your risk of both heart disease and heart attack is now the same as someone who has never smoked. Thank you for watching. Please like, comment, and subscribe.